for this. Thank you so much for being part of this November lecture series. So without wasting much time, we will quickly go into our lecture for today. And I'm glad to see every one of us that has joined. And I'm also glad that our resource person, Dr. Sarah, is in the building, so we can start immediately. Permit me to share my screen for a moment. All right, this morning or this evening, depending on where in the world you're joining us from, my name is Chibuzo Samuels, and I'll be the anchor for today's lecture series. This evening, our host is no other person than Dr. Sarah Rine. Dr. Sarah completed her medical school education from Bingham University. She's a graduate of the second set of doctors that graduated from Bingham University, popularly called Batch B, as we call it in batches. After her graduation from medical school, she proceeded to complete her internship training and mandatory National Youth Service Corps postings successively and successfully. During her days in medical school, she was active in the Christian Medical and Dental Association and once served as the school missions secretary. She is also currently the treasurer of the Bingham University College of Medicine Alumni Association. Following her completion of her National Youth Service Corps, she worked briefly as a medical officer, during which time she completed her master's degree in public health. She proceeded to study for a PhD in public and community health with a focus on global health, somewhere in the United States of America. She currently does global health work, including research and program implementation. She works with and collaborates, especially in East Africa, and her work is broadly focused on women's sexual and reproductive health. Her current research and project is focused on cervical cancer prevention among female sex workers and their children. She also has several peer-reviewed publications, and she has given presentations at several conferences. She enjoys traveling, and she believes that pursuing a career in global health gives her the opportunity to travel and explore the world while networking and making new collaborations. She is married to one male husband, and together they have a son and reside in the United States of America. Ladies and gentlemen, honorable colleagues, help me welcome our resource person for the day, a disciplined, focused, committed, and goal-oriented doctor in the person of Dr. Sarah Rine. Thank you very much. Sarah Rine, sorry, there's no S at the end of her name. Sarah Rine.
It's fine.
Thank you very much. Welcome.
Thank
Dr.
you.
Sarah, let me, yes, thank you. Let me end my screen share so that you can share your own screen.
Okay. Let me
Thank you. Please go ahead and share your screen, Dr. Sarah.
Yes. I have so many tabs open, so I just need to look for it. Sorry. Okay, can you see my screen?
Yes, we can see your screen.
Okay, let me share, make it a PowerPoint. How about now? Can you still see my screen?
Yes, we can see it.
Okay, are you seeing it in presenter mode or like just the screen?
Yes, in presentation mode.
Okay, so you can't see like the next slide, just the main first slide.
Yes. career
Okay.
options outside of the residency training. That's what we
Okay,
can say.
perfect. Yeah, I always go when I try to make it like in presenter mode. Anyways, thank you very much for the opportunity to give this presentation. When you were reading all of those things, I'm like, oh, this I can't believe like how God has brought me in a very short time. It is simply amazing.
Yeah.
I'm grateful to God for all of the opportunities. And yeah, I just want to share with us briefly the possibilities of having a career outside of the typical residency training we're used to. So I don't want to limit it to those who haven't really decided to go into the residency training. This is a presentation for those who haven't decided, those who are in the residency training, or those who have finished and for whatever reasons they want to move on to do other things. So yeah, along the line, I'm going to be telling several stories about myself just because up on at the time when I made the decision to like pivot into something else, not many people, I didn't have like many mentors, so to speak. So I'm just going to be drawing from my own experiences along the line and then we will discuss. I hope that this discussion is brief. So my presentation, sorry, is brief so that we would have time to like discuss and just respond to some questions and yeah, take it from there. I have this agenda I'm going to be using. First, we'll just look at some reasons why people might consider other career pathways. And then I have a list of some career options, which is not an exhaustive list by any means. It's just, to whet our appetite, so to speak. So for whatever interests you, you might have to do like a deep research to understand the nitty-gritties and all the requirements to go into those options. And then we're going to talk about certain important considerations, and then we'll finalize with questions, comments, and discussions. Please, I like to have, even you don't have to wait actually until the end. Or how do you want me to do it, Chibus? Or usually I would just prefer if there are questions, somebody can just ask along the line. Would you prefer to have it at the end or they can ask in between? I don't know. What do you think?
I think we can have the questions at the end, but if you have questions, anyone that has questions as we go along, you can type it in the chat box so that we have access to it at the end and answer all questions at the end.
Okay,
Thank you.
thank you. Yeah, thanks. So the first thing on the agenda is why would you want to consider other career pathways? If you're considering a career change, you might decide to leave like core clinical medicine. Along the line, when I moved here, I encountered some doctors who maybe finished residency or did not finish or complete their residency training. After the COVID pandemic, they were considering other options. I had interacted with one not too long ago, and his major reason was he felt burnt out. Like the COVID really stretched them to their limit, and he felt like this is not what he wants to be doing for the rest of his life. He felt like there are other opportunities out there and he would want to explore. So I think it's a viable reason for people to consider when they want to leave clinical medicine, just the whole I just want to do something different. I'm tired. I just want to do something different. And then another reason would be the personal desire to explore other aspects of healthcare. As we know, healthcare is multidisciplinary. There's so many mechanisms that come into play when it comes to healthcare. And then we have the physicians in the clinics who would prescribe medications, but these medicines are created by pharmaceutical companies. We also have like the physician prescribing or recommending certain laboratory tests, but then the devices that will be used to do these tests are made by like medical device companies, for example, or companies who make all of these things. So there's a complex interplay between all of these aspects to make healthcare what it is or what we're experiencing right now. And of course, you have nurses whose responsibilities is to nurse the patients, and you have other allied healthcare workers working together to ensure that everybody has the best of care at every point in time. Then another reason is just generally feeling unsatisfied with clinical medicine. I was at this point, and that was the reason, one of the major reasons why I decided to pivot into something else. I felt like there was something different I needed to be doing. It felt really I don't want to use the word boring, but for lack of a better word, I would just say it felt a little boring. It felt monotonous, waking up to doing the same thing all over every day, every day. It felt like I was just going to run mad one day. So that's one of the reasons why I decided to consider something else. And then you feel like you want to contribute elsewhere outside of the clinic. And then there are other reasons why people will consider having a career outside of clinical medicine. And these reasons might be peculiar to them and maybe their families and the decisions that they want to make. Like I mentioned earlier, we're just going to go through a list of some options. I said is not an exhaustive list. We'll just go into those lists briefly and just talking superficially about them. And then if it interests you, you would just go back to do some more research as you gradually or you make your decision about it. So, the first one I want to talk about is global health. This has become very popular for many doctors or many physicians right now. So people are transitioning from like clinical medicine to do global health work, or another name for it is like population science, population health. I just want to state that there's a difference between global health and public health. Um, I would say essentially they're the same thing, so to speak, but the major difference is geography. So global health is concerned with health issues that transcend national boundaries. So, like for example, if you want to study HIV, for example, across the continents and within the countries of each of those continents, we'd see that HIV is a global problem, is a problem that transcends just one country. And when you're looking at it, you're thinking about it as a global health problem. Even the COVID pandemic that, just ended not too long ago is a global health concern because it affected many countries at the same time. Unlike public health, where if you're a public health expert, you're more concerned about issues or health issues or outbreaks or epidemics that are happening in a country or in a state or within a given locality. So I would say the training is the same, but just the geography makes the difference. Yeah, and people who are public health experts can also work as global health experts depending on the kind of work they want to do and vice versa. So, and then global health, you have both research and practice. As far as practice is concerned, you're interested in program implementation and evaluating the program. So you have a specific intervention you want to implement within a specific population, all of the nitty-gritties that happen before you actually deploy that intervention within the population group, involves practice. So you have to be on ground, you relate with stakeholders, other collaborators as you try to design the program and, just implement it. And as far as research is concerned, whatever outcome of that program you have gotten, you sit back at it and do some kind of analysis, whether mathematical analysis or whatever kind of analysis you want to do. You look in depth into the data you have generated, and the idea is to help inform the next intervention you want to do. Or for some people, they just, write it out as a manuscript and it's published. This will help other researchers who are trying to implement similar intervention within different population. I mean, it's just a guide to help them, implement such intervention. And then ultimately, for many people, they dive into consultancy. So you've worked as a global health researcher or a global health practitioner for a bit of time. And then you want to go into consultancy where organizations will leverage on your experience and your expertise. And then you can work with them to help them design interventions, to help them, write out their research outcomes, for publication or to guide future interventions. So before I proceed, I want to just give a little story, or would I say, yeah, a story of my life of how I got to this point where I am now. I try to make it as brief as possible. So as we all know, you finish medical school, you have to do the house job, which is mandatory. Similarly, NYC. So it was during the course of house job, it was just normal, it was still part of the training. There was no responsibility, so to speak, that you had as an individual at that point. You're working in a group, in a team with other people who are responsible for you. You didn't have like personal responsibility to anybody. So you were just there, and I mean, it was just okay. And then during NYC, I had the opportunity to work in somewhat a rural place, and it was just I would say it was a bit burdensome for me because the work itself wasn't really burdensome, but the whole idea of working in an environment where there's lack of everything, lack of everything you can think of, it made the work a bit really stressful. It made the work burdensome. It made the work boring. It made the work monotonous. And I will wake up and I will do the same thing over and over again. And I felt I really needed to do something else. I don't think I want to do this for the rest of my life. I would get bored. So, but at that point, I didn't really know anybody who was doing anything outside the clinic. Like I didn't know any doctor who was doing anything outside the clinic. Everybody I knew was either a medical officer or doing residency. So I didn't know where to begin from. I didn't know what to do. So I just, continued my life and then finished NYC. So the plan was after NYC, I would come to the United States, try to read for the USMLE, do the exam, and then continue my life in whatever residency I would want to do. After NYC, I came to the US. During the course of my house job, I had made a friend and we had agreed that when we come to the US, we would become study partners. We would read together, plan, and, sit for the exam. And that happened. The first 6 weeks was focused on intensive reading. We read, answered past questions. It was okay. But I still felt that sometimes I would sit down and I'll ask myself, do I really want to do this for the rest of my life? I mean, is this what I want to do come 10 years or even 5 years from now? But I didn't know what to do, so to speak. So at that point, I was staying with my uncle who knew a doctor here. At that time, she was an oncologist. And then I had spoken to him about my reservations and my concerns and everything. He created a meeting between myself and this lady, and we spoke. She was also trying to come out of being an oncologist. She wanted to do something about wellness and all of that. She said oncology was draining her mentally because some of the patients, you've seen treating patients who have cancers for a long time and maybe they die. It was taking a toll on her mentally and she wanted to leave. So I told her my experience and I said I had only 2 years of clinical practice, and her advice was don't really make any decision with just 2 years of practice. Maybe you should consider going back to have more time in the clinic and then you can conclusively make a decision. That was the same advice my uncle gave me. And then I returned back to Nigeria at the end of 2018 without doing the exam. My dad was so angry, but anyways, we move. And then in 2019, early 2019, I got a job as a medical officer. I was just working. The first 3 months on the job, same feeling. I was tired. I is there something wrong with me? I just kept thinking, other people are doing this thing. How come mine is so difficult? Why can't I just make up my mind and all of those things? The boss I was working with at that time, a cardiologist, very nice person. He tried to like give me some advice. He kept saying, you're not here. You don't really enjoy this work. So why are you here and all of that? But I don't know. I just didn't have the answers. I guess I wanted to just prove to myself that for me to make a decision, I had to be sure. I need to be sure about the decision I want to make. So I remained there, but while I was there, I enrolled for my master's degree in public health, which I did online, and I was doing it alongside my job. I felt like that was what was now helping me a bit with my job because there was something else happening. I'm the kind of person who likes to have many things going on at the same time just so that I get bored very quickly. So many things have to be happening at the same time for me to really enjoy, myself, so to speak. So I was just doing that. COVID happened in 2020, and then it marks like a turning point, and I made the decision to like pursue a career in public/global health. During that time, in the place where I was working, the local WHO approached my boss saying they needed some volunteers to work in their steering committee, where we would have meetings, discuss how to educate people about COVID and all of those things that happen. And I quickly volunteered myself. He said, of course, he was going to volunteer me. I was doing a master's in public health and he felt it was the right thing to do. So I went on, I worked in that committee for 6 months and it was an amazing experience. And then it was at that point I knew I'm like, this is what I want to do. I see myself doing this for the rest of my life. And it was nice. I collaborated with so many people, worked with so many people, gave education to community health extension workers, to nurses, triaging, all of those things, and it was a great experience. Along the line, I applied for my PhD. I was admitted, and then that's how I moved to the United States. And then I came here In the first few months, I worked with my supervisor who was doing some global health work in East Africa, specifically Uganda at that time. And I joined her in her project. But I realized that some parts of her project needed to be answered. Like there were some questions I was looking at that needed to be answered. But I was limited, by funding. You need funds. If you're doing global health, you understand that you need funds for a lot of things. And as an international student, you have limitations as to the kind of funding opportunities you can apply for compared to like American citizens. Fortunately, the Cancer Center associated with the school where I am, they had this opportunity for everybody to apply for some grants. And my supervisor encouraged me. I applied and yeah, I got the grant, and that opened the door for me to like go to East Africa and do some part of my work and all of that. So that is the story essentially of how I came from, would I say clinical medicine in quotes, up onto global health. And this is what I'm doing now. And I feel like it has been a blessing. I have, made contact with so many people, and I feel like I'm making impact in this fair. So that's to point to like the reason why people might want to do something else. They feel like they can contribute in another way and not necessarily in the clinic. So I moved to other things. I've said so much about global health because it's my passion and I like it. The next option that you might consider is academia and research. If you're somebody who likes to teach, this might be something you will consider. And if you're somebody who is interested in having more time for other things, be your family or other businesses you might have, then this might be an opportunity you can consider. And then there are two options for academia, at least here in the United States. You can have a research-oriented academic position or a non-research oriented academic position. So for the non-research position, you're essentially just focused on teaching. You teach students, you make lesson plans, you mark assignments, help them in their research, just provide some kind of, would I say, supervision as they are working on their project and all of that. But as a research-oriented academic, you take on other research, and this can also be global health research or any other research that you might be interested in. You combine both of them. Some people like to do it this way because it makes them have to do many things at the same time. So it is important that if you want to go into academia and or research, you might need an advanced degree. For many people over here, I think a master's degree or a PhD in whatever field you're interested in. I've come across many people, or would I say the US education system for medical school, you can actually do a medical degree and a PhD alongside having them together. You can do them together. So many people jump at this opportunity. So it prepares them for academia if they want to, or just remaining in the clinic, or if they want to just have a career in both of them simultaneously. So that's an opportunity that people have taken advantage of. So that's something you can consider if you enjoy teaching, if you enjoy imparting knowledge, if you feel like you want to have time, it's something you can definitely do. But remember, you might need an advanced degree. Then another opportunity, pharmaceutical medicine is an emerging field here in the US, but I'm reading that in Europe, for example, in many countries in Europe, it is identified as would I say, clinical specialty or a specialty for doctors who want to transit from the clinic. So this is an opportunity for people who are interested in like drug development, interested in just understanding how medicines work, in understanding those who are interested in participating in the creation of drugs and all of those things. Usually these doctors who work there, they would, leverage on their education from pharmacology to anatomy to physiology, and they make contributions during the drug development phase. So they sit down with these other experts that work in the pharmaceutical companies, and leveraging on their knowledge of physiology, they can advise how best, to route some of these medications, how best is going to work in the body, the best approach to designing these medicines, and to optimize the outcome they're looking out for. And then doctors also play a role during the clinical trials. You can also be like a clinician who is interested in the clinical trial, or just a physician working in the pharmaceutical company who can manage and spearhead the clinical trials. You're managing the day-to-day processes of the trials, administration, watching out for side effects, documenting and writing, which eventually you might publish or not, and all of that. And then doctors are also involved in understanding drug safety and even creating like the antidotes to certain medications when given in excess, all of those things. So doctors have a role to play. And for the most part, you will need maybe an advanced degree. Here in the United States, if you want to dive into this, you will need to do like a diploma in pharmaceutical medicine and then integrate yourself into the system. And then if you're really interested in the business aspect of it, because as we know, pharmaceutical companies are out to make money. They are business organizations. So if you're interested in the business aspect of it as a physician, you can go ahead to have a master's degree in business administration, and then you combine your medical skill, your business skills, and you just combine both of them. And I believe that you'll do well in this industry, having both of these experiences. Yeah, similar to the pharmaceutical company, another option you can look into is physicians working in the medical device industry. We use a lot of, clinicians depend so much on medical devices for diagnosis, for predicting prognosis, for treatment, all of that. And we have doctors working in these industries to guide the creation of these devices that would have clinical importance. Um, I had the opportunity to have a discussion with a doctor who he had been done with his residency, but he had the opportunity to work in General Electric in like their medical device section. So he rose in that ranks and he became like the medical director of that setting. I don't remember what it's called right now, but he rose and became like the medical director in the medical device company in General Electric. So what they do is they just inform the industrial people the best way to create these devices, how it's going to have clinical relevance, leveraging on their knowledge of anatomy, physiology, and just trying to give, let's say, consultancy education to them on how to improve some of these devices. Some of these devices that, of course, they make incubators, ventilators. Doctors are heavily involved in the creation of these things because it's one thing to make these things, and then it's another thing to make these things that would have clinical importance. And so that's where these doctors come in. They want these companies to make these things that will be relevant to the clinicians and to maximize patient outcome. And then apart from the role that doctors play in the production or design of these devices, they also would serve as, would I say, teachers to other physicians. So these devices have been made, they've been created. You have to educate people on how to use it. So these physicians who have participated in all of these things go to the clinic and provide education to the clinical people on how to use the devices. And if there are problems or questions, they can also go back to them, to ask, and all of those will be sorted. So there are people, I'm speaking, with specific examples. I know somebody who has risen in this industry as well as a physician who left after he finished his residency. I don't think he even practiced for one day after residency and then joined GE, and he has risen up to the point of a medical director. So another option is health informatics and healthcare IT. This is, I think, is still relatively new. I mean, it has been in existence for a while now, but it's still relatively new. People have not really, would I say, leveraged on the importance of healthcare informatics. So if you're interested in IT, you're interested in AI, all of the technology things, information technology things, this might be an opportunity for you. I believe that many hospitals in Nigeria have some kind of softwares where they use for consultation, to request lab tests, to request medications and all of that. So there's a continuous upgrade happening within those softwares. As a physician, you can leverage on it. And we have people going to do like advanced degrees, excuse me, in health informatics just to maximize these softwares that they use for data management within the hospitals and all of that. Now, for some people, they can decide to combine this with research. So they are working as health bioinformatics. They can decide to do research because at the end of the day, you have a huge data set. You have several patients coming in every year and then coming in for different diseases. We're tracking their outcome using, we're tracking their progress, sorry, and tracking their treatment using these softwares. The information you get from this software is like a powerhouse that can be used in research to, would I say, better the system, to better patient experience, to better the healthcare outcomes, generally speaking. So if you're interested in health informatics and also the research aspect of it, this is something that is really good. I know of a lady who recently just completed her master's degree in health informatics as a physician. She's an MD, completed her master's degree in health informatics, and she's trying to, I think right now she's using the data set from this hospital to try to understand that, track some diabetes management and some research things going on within internal medicine and all of that. So that's something that might interest other people. Yeah. Because of time, of course, I'm not going to talk about everything one by one, but this is a list of other opportunities that are worth looking at. As physicians, you can have a role in medical insurance companies. I don't know the status of medical insurance in Nigeria, but over here, of course, it's a big deal. And then you have doctors working in insurance companies. They work as they can review claims. So when treatment has been done, they look at the claims from like the clinical aspect and decide if the company should pay or not, or if there are extra information that needs to be provided before they approve payments, or before the insurance companies approve payments to the doctors and all of that. They can also rise to become the directors of these medical insurance companies. And something that has even been going through my mind in recent times, even doctors in Nigeria can actually come together, pool funds together to start a medical insurance companies, not necessarily dependent on the government, because I believe that many people in Nigeria shy away from going to the clinics because of money and finances. But if there's some sort of, insurance, we would have more patients coming into the hospital and getting care, as against, turning to other alternatives because of cost. So if it's something you're interested in, you can talk with your friends, you guys can collaborate and maybe come up with an insurance company that will be different from what is happening right now. And then government physicians can work in government regulatory agencies. Oh, we see doctors working in CDC, for example, in the NIH, in the NSF, like in different regulatory organizations. Of course, we have doctors working there. During the pandemic, was it Anthony Fauci was heavily, giving reports and all of that. He's a physician, did his residency and all of that, and dived into policy. So you have physicians working within health policy sphere, giving regulatory advices, advising the government on maybe vaccinations, screening tests, and all of those things. So there's a role for doctors in these regulatory agencies. If you're interested in writing, scientific writing, this is something that is, will I say, emerging right now. It's something that you can do either full-time or part-time, and it is rewarding if you like to write. Somebody like me, I actually do like writing. So it is something that I'm also even trying to embrace at this point, medical writing. So people, for example, like I mentioned earlier, have finished their research. They finished their intervention, they finished their project, but for some reason, they don't want to write out all of those things, and they're looking for somebody who will serve as a consultant writer. The person comes in, they get all the details, and they go ahead to write across different spheres of healthcare problems or healthcare intervention. So this is an opportunity that you can consider if you do like writing. And then other business ventures, there are doctors who are business people who would do businesses in different spheres. The beauty of the MBBS is that the world becomes your oyster. You can do anything at all. The degree is very dynamic. You can use it to do anything you want to do. And I believe that you will succeed wherever you put that degree to use. So yeah. Then before we go into questions, I just had these things I wanted to talk about, important considerations before you decide. One important thing I want to say is if you're unsure whether to remain in the clinic or not, I would say continue in the clinic until you become sure. And that's what I did. When I was not sure, I actually still continued until it got to the point where I was like, okay, this is exactly what I want to do. Reason being that it is easier for you to transit from a clinical role to a non-clinical role. It is more difficult for you to leave the non-clinic into the clinic. So take your time, decide. If you're not sure, just give it some more time. It took me almost 2 years to make this decision. So take your time and decide before you leave. Because if you leave, it might be hard to go back. It's easier for you to leave than it is for you to go back. So if you're not sure, don't even try it. Then an important thing to consider is your family. Of course, your family is going to determine a lot of the decisions you're going to be making. So if you guys would decide as a family what is most important to you at that point in time, and what sacrifices or what's it called, what compromises you might want to make as a family, because each and every opportunity, even the non-clinical roles, would take time away from your family. You will give time, you will give resources, you will give everything. So it is important for you to know what your compromises and your limitations are when it comes to anything that would affect your family. So this is an important consideration as you're making this decision. One thing you should know is mentorship. When I made this decision, I believe it took long for me to make this decision because I didn't really have mentors, so to speak. Um, as I said, many people were in the clinic. I didn't know anybody who was outside the clinic at that point in time. And the advice everybody was giving me, no, don't do it, all of that, which was good advice, but there are people who have gone through the path where you're considering, seek advice from those people, make them your mentors. One important mentor for me was the boss I worked with while I was working as a medical officer. He kept encouraging me. He's like, you don't want to do this. You don't have to remain here. Consider this. Why don't you read this? And sometimes he will send me link to some things and I would just read them. And when the opportunity came to even volunteer with WHO, he literally pushed me to doing it. And, it is important to have people who are looking out for you, who are interested in your success, and they will give you like all of the will I say the tips and the advices needed to succeed. Then also another important thing to consider is geography. You know that some of these specialties or some of these options will thrive in one area, in one geographic location, and not necessarily thrive in another geographic location. So if you're interested in, for example, pharmaceutical medicine, I don't know how it works in Nigeria because it's not something I've dived into before. But over here, it's like, would I say lucrative is good and all of that. So you might consider relocating to where this job or this opportunity is. So this is something you need to consider. Do you want to relocate? Do you not want to relocate? All of those things. So another thing to note is you should know yourself. You should know your interests, your strengths, and your weaknesses. I know I, for one, I'm the kind of person who gets bored very quickly. I love to travel. I love to meet people. And leveraging on all of those things, it helped me make the decision that I made because if I remain in the clinic, I might not necessarily travel as much as I would want to. I might not necessarily meet and network with people as much as I would want to. I like to go for conferences. I like to, just travel. Recently I had to even go to East Africa, all of those things. These are the things that you need to understand. You need to understand yourself, understand what you're good at, and leverage on that as you're deciding what next to do. Income is very important. Without money, we can't do anything. Without money, we cannot survive. So you need to understand which is of importance to you. Is it income? How much money are they going to give for your experience and your qualification and all of that? You need to weigh it, and be like, okay, these people are probably not, would I say in quote, pricing me as high as I'm supposed to be priced, so to speak, given my experience, given my education and all of that. So when you're making a decision, it is important to understand income is important. And over here, they even give you the opportunity to bargain your salary. Unlike in Nigeria, in many jobs in Nigeria, they just employ you and give you whatever. But over here, you can even bargain how much they would pay you, and then you will reach a compromise. So that's an important thing. Job fulfillment, career fulfillment, just general fulfillment in life is important. You don't want to be stuck in a place where you're not happy. That unhappiness will transfer to your family, to your friends, and nobody wants to be around somebody who is unhappy. So it is important to know what gives you the most fulfillment and pursue it. And, your happiness spreads across to other people as well. So consider that. Then finally, it is important to follow God's plan for your life. While I was taking time making my own decision, I was praying alongside, just trusting God to put me on the path that He wants me to be. Whatever that is, I don't know, but I was just trusting Him to put me on the path for my life that I would make the most impact, and, so that when I'm leaving this earth, at least I would have done something and I'll be recognized for something. So these are considerations. This is just a small list. There are other things that might be pertinent to you or your family or your spouse as you're making this decision, but I just wanted to list this out as I conclude. So thank you so much for your time and listening. Right now we'll just take questions and comments, and yeah, thank you.
Wow, wow. What an amazing lecture. Thank you so much, Dr. Sarah. It was packed with things that I'm sure many of us have not considered before now. Like you said, when you have an MBBS, the world is your oyster. There's so many things that you can do outside of clinical practice work. So thank you so much, Dr. Sarah, for opening our eyes to some of these things. And I'm sure that the participants in this lecture have been endued with will I say questions for their mind to work on and options for them to look into apart from clinical practice. Thank you so much, my God bless you.
Thank you.
Um, I don't know if we have any questions. At the moment there are no questions I can see. I cannot see any questions on the chat. I don't know. So I'm going to open the floor for the next few minutes. Please, if you have questions, just raise your hand and then we'll give you the floor to ask your question. Thank you. Okay, since no one has any question, so we'll probably have to round it up at this point. All right, I think there's a question in the chat box, Dr. Sarah. Can you look and answer? There's some questions. Thank you.
Okay, thank you for your presentation. Do you think doing a residency before going into public health gives an advantage? I don't know what the residency training is like for community medicine in Nigeria. I don't know if they incorporate like some clinical aspects, maybe seeing patients and all of that. But for whatever reason, you would have to decide which is of most importance to you. Personally, I didn't do a residency before, diving into public health because I felt like, and this is just my reason alone, and it doesn't have to really apply to you. I just felt like whatever I'm going to learn in the residency might just be a bit limited because with a PhD, it is broad. You learn so many things at the same time. But I felt like doing the residency, they will take a more clinical approach to doing it compared to if I have a PhD, which like I feel like is like it gives a wider scope to it. And this is just my thinking, and it might not really apply to you, but this is how I looked at it. And that's why I decided to make the decision to just do like a PhD in public and community health and not necessarily doing a residency.
All right, thank you. It's also important for us to know that there is residency in community
Community
health
medicine,
or
yeah.
public health rather. Yes, there's a residency program on it, and I think that um, they do a lot of work too. That maybe you may see in a master's, but maybe not up to the extent of a PhD. And so, if you're really interested in community health, you may need to look for someone that is probably doing a residency training in community health, or and also talk to someone that has done a master's and PhD and compare what they have to say about your questions and make a decision.
Yeah.
Thank you. There are other questions on the chat box. Dr. Sarah, can you
Yeah.
look through?
Oh my goodness, this question is very interesting. Um, Somebody is asking for the recording. I think Dr. Chibuzo will send the recording after today. And then thank you for your presentation. If you didn't have the option to migrate, how would you have navigated the change in area of practice? If I'm being very honest with you, I think I'll just end up doing like a residency in community medicine because that would be like the next best thing, or will I say the next closest to what I wanted to do. And then migrating was also important to me because I just felt like there are wider opportunities for me outside of Nigeria. But if I didn't have the opportunity to like leave, I bet I would have been doing maybe a residency in community medicine. Yeah. So the next question, if I understand you well, not doing residency means someone will have to do MPH and even PhD to grow outside in the profession, right? Not necessarily. The PhD is very good for, but usually it's for people who want to take on some kind of research. So with a PhD, you learn a lot of research skills which the masters might not give to you. But if you want to really focus on just maybe public health or global health practice, a master's degree is sufficient. Like many people who do the job, have just a master's degree and that's fine. But if you're interested in like exploring research, you want to learn how to write scientifically, you want to, do research properly, then you might consider a PhD. But if you just want to practice public health, program implementation and all of that, a master's is sufficient. You don't have to do a PhD and you will still grow to the top. Recently, I attended a conference and I met a Nigerian lady who she works in one of these NGOs in Nigeria. She has a master's degree and she's been working over there for a while now, just doing program implementation. So you don't have to have a PhD to do that. Yeah. Then the next question is, thank you so much for your presentation. Please, can there be a room for mentorship here from our seniors who have already gone ahead of us? I guess this question is for the chiefs and all of us, not necessarily for me. Um, the possibility of mentorship, Dr. Chibuzor, for those who have gone ahead, is going to be helpful to guide decision making.
Yes, thank you.
Yeah,
I
yeah.
think that that's part of why we're doing this lecture series, and we're bringing people with experience in different areas to leverage on their experience and skills and share with us. And so just be part of what we're doing on the group, and you will get as much mentorship that we can have in a group setting. However, if you really, the benefits of mentorship is like finding somebody, or rather the idea behind mentorship really is about finding someone that is doing what you would like to do and connect with the person so that you can learn as much as you can from the person. So why we do all these lectures is to expose us to different things that can possibly catch your fancy and that you may want to be interested, that you may be interested in and you may want to follow. And so if you are open to it, then you can look for mentors in specific areas that you want to pursue. Yeah. So please go
Yeah.
ahead, answer other questions.
Okay. Is it easy to get admission for PhD with scholarship in any university in the US for somebody? Um, Honestly speaking, you don't even have to have an MPH before you apply for a PhD in public health, at least in many schools. From my experience, you don't even have to have an MPH. So with your medical degree, the medical degree, as I said, already gives you an advantage because most schools will require that you have some kind of exposure to physiologists, anatomy, biostatistics, just like some limited exposure to these things. They don't expect you to be an expert by any means. So yes, you can apply directly with just your MBBS. You don't even have to have an MPH. But if you have an MPH, it's an added advantage, and you can get a PhD admission for many schools. If you're applying for a PhD in many schools in the US, it's almost always guaranteed that you'll get a scholarship. So once you are admitted, it's tied together. You don't have to do like a separate application for the scholarship. No, at least in the school where I am, like you just apply, and once you're admitted, you already have a scholarship automatically. And that's how it is, I guess, in many other places. And if you're lucky, some schools might be kind enough to also give you like a monthly stipend while you're doing the PhD. Some others might not, but some will. So you just need to just go back to Google and, make that research and figure out which schools might give you a scholarship and stipend and health insurance, all of those benefits. Yeah. The next question is, my question is that going to other European countries like Sweden to do masters in public health, is the degree also recognized globally like the UK? The only problem I would say I have with European countries is the language. I wasn't going to go anywhere where I need to go and start learning any language. And I noticed that for many people who go to Europe, it takes them a bit longer because of the language requirements. And I don't know, their process is a bit different. I can speak a little bit about Germany because I know people who have been there a bit. So apart from meeting the language requirement, there are other certain nitty-gritties that you would have to meet before you actually even start practicing. Imagine if you want to go and do clinical medicine like in Germany, apart from the language, they have some wordings like that of certain things that you would have to meet up with before you even begin to consider a practice. So it's doable, but the processes are a bit longer. And yes, these schools are globally recognized anywhere you go. So it's not necessarily dependent on the country per se. I mean, even the degrees we have in Nigeria are globally recognized. Most times, all you need to do is to just evaluate them, just put them on a scale with like a typical American school, and they give a score to that. But so long as you got your degree from a reputable institution, it will be recognized anywhere you go to. So it's not limited to just the country. The only challenge I have with Europe, as I said, is like the language barrier and some of these other little requirements that you would have to meet before you blossom into your career. Unlike the US or the UK, where you don't have to learn any other language and you can just come in and hit the ground running. Um, to join some of these organizations like NGOs and these global health bodies, what are the requirements? Like, what should someone do to position oneself for these opportunities? Networking. This is like a very big deal. Like networking, many people have gotten jobs they didn't necessarily apply for just because of networking. You go for conferences, you meet people, and then they tell you, oh, we're looking for somebody who will do this and this and this. And you just fit the bill at that point in time and you can, get a job through that. So networking is very important. And then looking at some of their websites, many of them have like the careers option section where you can click and then you see vacancies, read through the vacancies and see what the requirements are. If you feel like you meet the bill, fine, you apply. But some organizations just do all of those applications, just to fulfill all righteousness because they probably have somebody that they want to employ, but it is a requirement for them to have an advert. So they will just do that. So it is important. I believe that networking, it has, from my experience, it has really helped me. A lot of the things I've been able to accomplish was networking and just leveraging on the experiences of my supervisor and her network, so to speak. So I just came in, leveraged on her networks, and I've been able to do certain things. So networking is important. Apart from the academic qualifications, it's important to network with people. Yeah, and then if you can, you look at the website and apply directly on the website. If you're lucky enough, you get invited for interviews and you'll be given a job. What are these opportunities?
Yes,
Challenges?
sorry,
Uh-huh,
Sarah,
yeah.
the questions I posted are from the link that we sent earlier in the day for people to ask questions.
Oh, okay.
Yeah, so most of these you have already answered. So I don't know, maybe you can skim through and see
Okay.
if they are, most of them have already been addressed by your presentation. But maybe you can look at the last three questions that I itemized there and see if
Okay.
there's any answer you can give.
How do we get unlimited access to information concerning available opportunities within and outside the country? Because everything seems concealed. Even the internet don't seem to do justice. I would say a lot of times, I don't want to speak bad about Nigeria, to be frank, but I feel like sometimes when you're making research or you're even, in fact, over here, there are some people who say that if they get requests from maybe Nigeria, for example, to professors here asking, oh, I want to come to your program and all of that, they will probably not, they will read them and probably not reply because of the reputation of, would I say, scamming and all of those things. So people have had opportunities taken away from them just because of the reputation of the country. So, like I mentioned earlier, it is important to network. And then if you see somebody doing what you're doing, what you're interested in doing, I think you can just walk up to the person or email the person or whatever directly to ask. For example, if you're interested in what I'm doing, for example, you can email me directly and we can have a discussion. But for the most part, from the little discussions I've had here, most times when emails are coming, oh, Nigeria, once they see Nigeria, for people here, it's like a red flag just because of the reputation that we've had with scamming and all of that. So it is important to network again. Networking is very important. And then leverage on the experiences of other people who have gone ahead. If you've seen somebody doing what you want to do, especially if the person is within this alumni group, it's easy to just, approach the person and ask, about specific questions and guidance on how to proceed. Um, is there a general accessible page with regards to openings for residency exams and or programs, as well as the vast majority of specialties one can make do with in having a list of areas? Okay. I mean, as far as the rest, if you're doing USMLE, for example, there's a whole website on USMLE, and if you're an international medical graduate, there's a whole process, you have to do registration and all of those things. So that's already there. They have like a structured pathway already for those IMGs, international medical graduates who are coming to do residency. So I won't really speak to that. But when it comes to like the other specialties, I don't think they have any structure like that. So a lot of times the information you get, you have to like research by yourself, or somebody who has gone ahead, you're asking the person for directions and all of that. But many of these would I say other specialties or other career options don't really have like any formal structure. You need to do the work by yourself and then figure out and make your own course by yourself. But I know of somebody, I don't know, I can ask, there's somebody I can ask with regards to having like a compendium of, would I say, specialties, especially when it comes to like what's it called? Non-clinical specialties that somebody can pick from. I think somebody did mention it. I was having a conversation with somebody, if I'm not mistaken, and it was brought up. So it's something I can ask around. And then if I come across any link or like a list that has all of these things, then it's something I can share to the group and it will benefit everybody. But as far as I know, these other areas don't have any structured formal way of, incorporating yourself into them. Unlike the USMLE that has a pathway already specific to IMGs. And then the next question is for everybody. Can we be having more sessions like this? I guess so. It is really needed. Thank you for your time and effort. Okay, do you have any specific advice for someone interested in global health and health informatics? And can these interests be combined? Yeah, it's something I didn't say in the presentation. You can combine anything you want to combine. If you're like me who has interest in so many things and want to do so many things at the same time, you can combine anything. It just depends on the time you have and like your general interest. But yes, you can combine anything. I would take the example of my husband, for example. He has He's a microbiologist, does like his research is in microbiology, focus on like pro and prebiotics and all of those things. But he has a master's in public health. So he does public health work, even as a consultant, like public health work. So and he teaches as well because he likes to teach. He teaches both undergraduate and postgraduate students. So he's doing all of these three things simultaneously. So yes, you can combine anything you want to do at all. There are no limitations. Thank you. Thank you. Have my email address. I can type it here. Let me type my email address. Here it
Wow,
is.
thank you so much.
Yeah.
Thank you so much, Dr. Sarah. We appreciate we appreciate your time. I think maybe the person that needs your email address can contact you privately
Yeah.
to get it. Thank you so much, ma,
Thank
for
you.
this lucid presentation. It's been eye-opening, even for some of us who are exiting the residency program. Like you said, it's not just for those about to start. Some people that are maybe exiting the residency program might have interest in other things.
Yes.
May want to pivot, and if you want to pivot, the experience, the wealth of experience you have gathered, the knowledge you have gathered will be extremely helpful if you
Yeah.
find a niche outside clinical work. So thank you so much, Sarah.
Thank
Um,
you.
Thank you for making that time. I'm sure we'll find another topic for you to present for us in a time not too long from now.
That's
Thank you
fine.
so much. God
Yeah,
bless you
thank
for your time. So,
Hello, sir.
thank you. Yes, yes. Someone has a question?
I think some of us have our hands raised. So
Oh, okay.
Okay. Sorry, sir. Please, I did not see
I
the raised
think
hand. Please, okay, hold on. Let me look at that. Okay.
I think there's
Dr.
one Dr.
Olusegun, please
James.
ask your question. Ask your question, please.
No, I think
Or
Dr.
make your contribution. Thank you, sir.
Okay, I think Dr. Joshua James actually raised his hand earlier. I don't know if he still wants to speak. Okay. Thank you very much, Mr. Chairman, and thank you very much, Adama. Oh, sorry,
Yeah.
Dr.
No, it's
Rine.
fine. It's fine, please.
It's nice hearing. It's nice hearing your voice again,
Yep.
and at least it was very clear. You have not started demonstrating accents yet. It's all right. Thank you very much. It was a very interesting session, and really learned a lot. And like Chibuzo said, at least it would actually, it's very important information for people that are exiting residency, especially people that really don't know what next to do after residency or they're not sure yet. I think it's very interesting. And like someone said, I think we should keep up with this. It's a very interesting session. It's very educative and informative as well. Yeah, thank you very much.
Yeah, thank you.
Any other thing to say before we round up? All right. In the absence of any other questions, let me specially thank every one of us that has made our time to be part of this lecture. Thank you so much for being here and making our time to be here. Thank you to all our participants, and let me also especially thank all the members of the executive committee that are here, and also all the members of the board of trustees that are also here, and also special thanks to our resource person, Dr. Sarah Rine.